The theory behind it really is when we bought implementing recovery through organisational change. They were a group that we're commissioned to help us build the college, and they talked about recovering the organisation, so moving away from, I guess, those old institutional care models. We're in a new hospital here as well, so it was about, you know, how do we start to recover ourselves as an organisation? How do we build networks and co-produce networks with our third sector partners? How do we properly engage and represent service users? And how do we start to create posts where people with lived experience of recovery can start to work with us and help us change as a service? We've got a limited number of peer workers in the service, but we'd really like to grow that. The idea being that if you're a mental health worker and you're working with someone who's been through the system and has recovered as a part of that, then that changes the way you are as a professional, how you work as a professional group, and your thinking is much more inclusive of service users. So the college is absolutely critical to that. It's our first service that's run by an ex-service user, someone with lived experiences of mental health services. It's our first service where someone's actually running that within the mental health clinical board, and with that we have other staff within there, so we have an occupational therapist in there. We'll be having 2 more peer workers in there as well. We've got admin team in there, so the majority of that staff group will be people with lived experience of mental health problems.